This is going to happen all over the world. It was beginning to happen, particularly in poor countries or resource-poor countries, because people have got to come in and travel in, and maybe the travel's not there. They may be 12 hours away and have to come in to see a doctor. So actually having them on, like you and I, talking on a computer, and you could say, well, they'll not all have computers, but pretty well that's going to be the case worldwide. Then you can often solve the problem, discuss the issues, arrange to have the medication prescribed without actually bringing them in. And with the COVID situation at the moment, that's happening all the time. We're not seeing most patients anymore. We're speaking to them over the telephone. And certainly in a modern healthcare system like in the UK, that works very, very well. We're not going to go back to everybody sitting around in a clinic waiting for me to have the time to give them 5 minutes. And arguably, if you're late, it doesn't matter because people are waiting, and you've got time to spend with people because you haven't got somebody else sitting in a chair outside waiting for you to see them, and you feel the pressure when you're doing clinics of people waiting. So this is the way the world's going to go, both in the developing world and in the developed world. It makes a lot of sense to do that. Not for everybody, of course. You do have to have some contact with some patients. And clearly to get imaging done, you may have to come in to get, the EEG. We've talked about whether they can have EEGs at home and just press a button and send it online to somebody to read it. And that's quite clear to me. This is the way we go. This is the way healthcare in general is going forward, not just epilepsy healthcare.